Hello, ladies and gentlemen. Thank you very much for joining me today in beautiful Ojai, California. Well, I wish you were here in beautiful Ojai, California. It's very beautiful outside. I'll probably do the webinar a little quickly today so I can go outside and join the good weather. But today's subject is natural treatments for common liver conditions according to Ayurveda. So I think first let's cover what are the important functions of our liver, and that will help give us better insight into the signs and symptoms of liver imbalances. Because we're going to talk more, not just about liver failure or cirrhosis of the liver or fatty liver or enlarged liver, these medical conditions, but also imbalances of the liver that will lead to a medical condition. It's very important to be able to identify the signs and symptoms of a poor liver function and be able to classify the state of your liver to be able to treat it. So we're going, and this is where Ayurveda really excels. Of course, Western medicine, they like to look at, certain enzymes in the liver, but this generally isn't sufficient. Generally will show that like the bilirubin is high, and we know the liver's not working well. But this is, not all cases, will have high bilirubin until there's a more severe damage to the liver. So there'll be plenty of symptoms that are coming for years in advance that if we can identify these symptoms, then of course we can treat our liver and recover and avoid a medical condition. So that's my hope, is not that you already have a serious life-threatening medical condition with a failing liver. My purpose here is to help you to identify imbalances of your liver and gallbladder to some degree, and to identify them and know what you can do to improve your liver function. So first, let's talk about, our liver. And in Ayurveda, Yakrut is the name of the liver. And, it basically means, that gives you kind of strength and avoiding fatigue. So one of the most common symptoms of poor liver function is just fatigue. Of course, allergies, inability to digest fat. These are all, signs and symptoms, because the functions of the liver, one, of course, the metabolism or even the emulsification of our fat that we digest in the duodenum as the bile comes out of the gallbladder. This is emulsifying and breaking our fat down into fatty acids so we can actually absorb it. So one sign of poor liver function is, an inability to easily digest fatty or oily foods. Generally the feeling is nausea, wanting to throw up. And of course, if you have a gallbladder attack, you may throw up as well. But, this is one of the signs. And often people just avoid oil, avoid fat, and cut back on the fat, but this isn't really solving your liver problem, maybe delaying it. But of course, it could create nutritional problems by eliminating all fat in the diet. And of course, our liver is really responsible for helping us to digest, protein, carbs, and besides just fat, and even the absorption of almost all minerals, calcium, magnesium, and of course the fat-soluble vitamins, D, E, and K, and A, fat-soluble ones. So, deficiencies of these fat-soluble vitamins can actually be due to a poor liver function, like very long periods of vitamin D deficient, even though the person is going out in the sun and you would think they didn't have this vitamin D deficiency, but it still shows. This can be one indicator. You can't just go by one indicator. Oh, you're gaining weight, or you don't like oily foods, or your vitamin D is high. That's not enough to determine if your liver isn't working. And of course, the liver is making a bile, and we're making anywhere from 500 milliliters up to 1 liter every day of bile, of course, stored in the gallbladder and excreted in the duodenum. And it's the bile that's helping to emulsify the fat and to digest, even helping with proteins and carbohydrates. And also, of course, bile is extremely alkaline. So it's helping to alkaline the entire body. And, you know, when the bile is in the liver, it's kind of red. And then when it goes in the gallbladder, it's a little more greenish, it's more concentrated. And then when it mixes with other digestive enzymes in the duodenum, then we get a more of a yellow color to it. And of course, liver is helping, is supplying all the blood to the body and purifying it and getting rid of waste products, including all the dead bacteria. Of course, our red blood cells only live about 120 days, and the liver destroys the old ones and excretes it through the bile. And it also keeps the body warm, helps with immunity and absorption, really, of all minerals, and also helping to eliminate metals from the body, zinc, copper, and even heavy metals like mercury. So whenever you're doing a heavy metal detoxification, then you know, improving the liver function and improving the bile output is very, very important, because this is the way the body's eliminating heavy metals on a daily basis. And of course, bile also contributes to, because of its nature, it helps with the bowels and helps the elimination of bowel. So a lot of times people who are chronically constipated, it's because of liver problems, because they're not producing enough bile. And of course, it's also helping with you know, allergies. Almost all allergies can be improved from improving the liver function. I've always known this, that the liver is related to hypersensitivity and reactions such as allergies and, you know, and asthma. But I read technically it's because of the mast cells that are formed in the liver become toxic, and then these mast cells are covered by this type of toxins, and then they produce an antihistamine when they come in contact with other proteins, and this is why you get in this reaction. That's more from a, you know, anatomy point of view, but from just a clinical point of view of treating somebody, you can always benefit by treating the liver if there's allergies and any type of sensitivity. And of course, one of the main signs of poor liver function is fatigue. And in Ayurveda, it explains that the liver, you know, it's the home of Pitta, or Tejas, the essence of Pitta, and has what's called a Batu Agni, 5 digestive fires that are digesting the air, the fire, the water, and the earth elements of all of the food that we digest. And that aligns with what we just said of the different functions of the liver and absorbing protein, fat, carbohydrates, and minerals. And, you know, the liver, as you know, uses iron, folic acid, and B12. And in most cases of a chronic anemia, particularly in a person that doesn't have any bleeding, or you have a person, a male that's not having a menstrual cycle, obviously, or a woman who's not menstruating, but they're still having chronic anemia or iron anemia, then we can assume this is the liver, because B12, folic acid, and iron are all necessary for liver production. And when the liver is, with liver function, and when the liver is not working properly, you know, then we can see that we can have these types of anemia. And of course, I hope you know that when you have a B12 deficiency, you get these little sores on the side of your mouth. And if you get a folic acid deficiency, you get little red dots all over your tongue. So this is an easy way to spot it. And of course, if you're anemic, you can or you're worried, you can roll the eyelids down and look under the eyelid and look for the red blood cells. And if you see a white moon, then you see there's anemia. And you can get quite good at guessing to the degree a person's anemic by just looking under the eyelid. So let's talk about And of course, another sign of poor liver function is yellow tint in the skin, yellow nails, yellow hands, and ultimately this we call jaundice. But if you had complete liver failure, your stool would become ultimately white because of no bile. But let's just talk about some of the 3 classifications of liver imbalances, we could say, now that you see how important the liver is to your health and how many aspects of your health are affected by liver. And we can often treat the liver and get a lot of benefits for allergies, weight loss, metabolism, energy, absorption, anemia, all can benefit from a liver treatment. And we're going to talk about the types of herbal treatments, because almost all medication to some degree damages your liver and your kidneys. So really you only have herbs to work with to improve liver function, because the herbs are only known substance that can actually benefit the liver and not harm it and actually help it recover. And we're going to talk about that. So the 3 classifications of imbalances, of course, in Ayurveda are Vata, Pitta, and Kapha. And, Vata type of person is cold, thin, light, dry, mobile, rough. And symptoms of poor liver function, it can be some of them that are already mentioned, like anemia, fatigue, but specifically, then you have to classify the person's state of their liver, which often is in line with their prakriti or their body type, but not necessarily. Signs we have a Vata type of imbalance would be cold. They're cold, because the liver is helping to keep the blood warm. And when the liver's not functioning well, the person becomes colder. So, but this is a Vata imbalance on the liver. The blood becomes cold, circulation becomes poor, hands and feet become cold. The person starts craving hot and sour foods. Even can get heart palpitations, gout, varicose veins, and little spots all over their skin, aging spots, brown spots. When you see brown, you're thinking dark color. It's generally more Vata. Well, Pitta will be more pink and more red, and Kapha will be more white. So if we have this poor liver function that we can see, maybe their inability to digest fats and fatigue or allergies or anemia, chronic anemia that's not recovering from normal treatment or change in diet. And then on top of that, we see the person is thin, cold, light, dry, and particularly has cold hands, cold feet, cold body, and circulation problems and craving hot foods. And we know this is a Vata imbalance in the liver. And to the Vata imbalance ultimately, is going to, it's the gunas or quality of Vata that affect the liver. The dry, light, cold qualities of Vata make the liver dry, stagnant, and can start to stagnate the bile, and the bile becomes hard and dry. Often the same person with a Vata imbalance has hard, dry, and chronic constipation because the bile's not coming out, so they're constipated, the stool's dry, their skin's dry, the gallbladder becomes dry, and then the forming stones, and you have gallbladder stones. So these would be, and ultimately cirrhosis of the liver would be the ultimate, a Vata imbalance where the whole liver is starting to die. And this, of course, can result from alcohol use and other causes. But the main thing in treatment is we have to identify which of these 3 categories we're in, Vata, Pitta, Kapha. So those are the Vata category. Pitta person, they still could have the fatigue, the digestive problems of fat, nausea when they have fried foods. We could see symptoms like that, but then we have to classify and understand the liver better to see if it's, of course, according to Ayurveda, we're going to treat the causes. We just can't take a liver tea and just drink some dandelion tea and hope for the best. It's better to diagnose and classify the imbalance. So if it's a Pitta imbalance, you'll see redness on the face, rashes, hives, eczema, psoriasis, liver problems, hot flashes, and burning hands and feet, because the liver is now not like the Vata imbalance where it's becoming dry and hard and cold and not functioning. It's becoming inflamed, we could say, inflamed and hot, and can be enlarged as well in this case. But the main symptoms we see is skin problems, rashes, heat, hot flashes. Oh, red eyes, bloodshot eyes is another sign. Any mouth sores, bleeding gums, bleeding anywhere, even excessive bleeding from menstruation or a wound. And the liver can become very sensitive to touch. Under the right rib, you can press on the liver in this type of case, and it feels not necessarily hard, like a Vata liver will feel hard, like you're pressing something very hard, because it's kind of like becoming hard. The quality is a Vata, dry and hard and blocked. But in the Pitta liver imbalance, it's become sensitive and inflamed, and skin problems, burning hands, red eyes. These are the typical symptoms of a Pitta imbalance in the liver. And then, of course, Kapha imbalance of the liver, we're going to have conditions like cholesterol, where we have Kapha, Gati, Raktavaya, which means Kapha, which is dense, heavy, slow, a liquid type of qualities, with a more of a heavy person with excess body fat, muscles, and big bones. There's often swelling, edema, stagnation, and cholesterol. And then fatty liver, this would be in this category. And we can also have, varicose veins with, clotting involved here. And you can result with congestive heart failure, and then result in hypertension. But the main thing that you're going to see is the cholesterol in the enlarged liver. So this is probably the most typical imbalance of the liver, is a Kapha imbalance with the high cholesterol, fatty liver, and this results in sluggish bile, which creates congestion and blockage. So if it's a cholesterol issue, then we want to treat the cholesterol as well, but we're really treating the liver. When we treat cholesterol, we're treating the liver. I mean, the liver's job is to maintain and balance the lipid level in the blood. So if the person's diet is extremely poor and they're having fried food and eating Kentucky Fried Chicken, or they're in the South just having fried chicken and bacon fat, they're having their breakfast cooked in bacon fat every day or something like that, then we know it's the diet creating this high cholesterol and this fatty liver. But what happens if they're a vegetarian and they still have high cholesterol? Then we know it's the liver. So that's why cholesterol is also, the one of the main signs of liver issues, high cholesterol, because we know whose job is it to maintain the fat levels in the body. If your diet's good, it's the liver. So the liver's not doing its job. So that would be not necessarily a Kapha liver. It still could be a Vata imbalance, but because the liver, it's the dosha, Vata Pitta Kapha, is adversely affecting the liver and creating its poor function. And then when the function is poor, then we see these signs and symptoms that we're talking about here: higher cholesterol levels, more fatigue, more allergies, etc. So let's talk about how to treat the liver with both diet and herbal remedies. Now, of course, you have to remember, we have to stick to the classification of Vata Pitta Kapha, because you couldn't, the treatments are completely different for the three doshas, because we don't want to imbalance the person's own dosha and create a dosha vrudi, where we're increasing one dosha by trying to treat the liver. So it's very important to be able to diagnose the liver and even know the degree in which it's functioning. It may just be having poor function compared to, for example, cirrhosis of the liver, or you may just have thick blood, which you can feel in the pulse, but the cholesterol and the LDL and HDL levels may not be too high or low for the doctor to be concerned. But in Ayurveda, we can feel the thickness of the blood as it pumps through the veins by feeling the pulse. So first thing, of course, let's talk about some dietary guidelines for the liver for all three categories in general terms. We know what harms the liver the most is probably alcohol, and particularly hard alcohol is very damaging. I've heard people even in their 30s who were drinking probably since their teenage years and already had, alcoholic liver, and even early stages of cirrhosis of the liver. So alcohol is probably the most damaging. So if you have any type of liver issues, you need to stop all alcohol, including wine and not hard liquor as well, because it's part of the liver's job to, break this alcohol down and the sugars. And it's just creating a more burden for the liver when its function isn't poor. And also fried foods, are difficult to find. Trans fats, fatty, fast food is full of unhealthy fats, which become a burden for the liver and start to create congestion and blockage in the liver, which usually results in gallbladder problems before even liver problems. So, gallbladder is not an organ per se, it's just a sac holding the bile. So it's not the gallbladder's fault. I mean, if you start forming gallstones, it's still going back to the liver. So you always have to treat the liver. That's why people who have the gallbladder removed still have subsequent problems, because they didn't remove the cause. You still could have a poor functioning liver that's going to make stones again. This time you just don't have a gallbladder to put it in, which creates a whole nother host of problems. But if you, and I think gallbladder is one of the most common, removal is one of the most common surgeries in the United States. I think 6-7% of the entire population in the United States has their gallbladder removed. So this is a very common surgery, and it's really just like high cholesterol. It's just it's a liver issue. I mean, people should tell you, if you have high cholesterol, you probably have a poor liver function. If you're forming gallstones, you have a poor liver function. If you've got chronic allergies, there's something that your liver is partially at fault here. So that's why treating the liver is just so effective. Even for weight loss, many people have dieted and extreme diets, done a lot of exercise, and did not lose weight, not lost weight very much. And then as soon as you start treating their liver, which of course is helping them absorb more nutrients, which then gets rid of cravings that they may have had, and also helps with the metabolism of fat, then they start losing weight. It's very common. If many people come in, they can't lose weight, try everything, we give them liver herbs, and suddenly they start losing weight and having more energy. So it's very, very important as a practitioner to be able to identify these liver imbalances, because they're not yet diseases per se. We're not talking about hepatitis or cirrhosis of the liver or even fatty liver. We're talking about an imbalance. That's still affecting you. It's just maybe not showing up on your blood work. So the foods you really want to avoid is, like I said, alcohol, fried foods, and even too much sour foods like lemon, lime, vinegar. I mean, these will also be eliminated in many serious liver conditions. And of course, hot spices, chili pepper, cayenne pepper, and a lesser degree, but definitely with the pitta imbalance, acidic foods like tomato sauce and tomatoes and eggplant. So one of the worst things for a liver would be some spicy tomato sauce chased down by some alcohol. This would, if you did this every day for a while, which I have met people who said they loved drinking and had spicy food, and they're coming to me clearly with liver issues because they've been to the doctor, and the doctor's even shown them they had either, high liver enzymes or fatty liver. But you don't want to really wait until the blood work is telling you you have the problem. It's better to catch these imbalances in the early stages and treat them, as all conditions are much easier to treat in the early stages. Unfortunately, most people come to me, in the late stages. So first you'd want to change that in your diet, and then of course you'd want to adjust the diet to your Prakriti, Vata, Pitta, or Kapha. So let's talk about some herbs, because the main treatment for liver is herbs. And of course, no fast food, no spicy foods, no alcohol, no smoking. I mean, you have to live a life like a monk once your liver starts failing, you know. So, and all home cooked foods, no eating out, no more McDonald's. I know, even, In-N-Out burger is not going to do it. Even eggs, yolk can be too much for the fatty liver. And there are certain oils like sunflower oil, which is probably the best oil to be used if you have liver failure, not coconut oil. And even for some types, olive oil can be too hot for the pitta type of imbalance. But sunflower oil is safe for Vata, Pitta, Kapha if there's serious liver problems, particularly the digestion of liver and particularly fatty liver, and particularly when there's high cholesterol. We just use sunflower oil. It's amazing how well it works. People who say they couldn't have anything fried or oily, they do okay on sunflower oil. The lesser degree, olive oil. Avocado oil. So let's talk about the most typical herbs used for treating the liver. We'll just break down this bag right there. This is a liver tea using traditional Western herbs, dandelion root, burdock root, milk thistle seed, supported by little coriander, turmeric root, and cardamom. This coriander, the cardamom are just more for the cooling effect of coriander, because you want to cool the liver. By nature, it tends to be hot. Licorice is used just as a catalyst, kind of it's another root, making all the other herbs work better together. And cardamom is just for the flavor, because cardamom is really a wonderful taste. And turmeric is also helpful. So this is just a wonderful tea that improves the bile flow and detoxifies the liver. It works very, very well. And of course, we're using all organic herbs, which is very important. And I didn't mention that if you start to have liver problems, not only do you have to not eat out and eat at home, you should start cooking everything or organic and only use organic food. So, people who are vegetarians eating organic food are very unlikely to have any type of liver problems, because this is the two areas of fried foods that will make it too kapha, and too much chemicals will increase pitta, and you can have a pitta imbalance in your liver, which results in skin problems. So this is a very good tea. We got, here's the milk thistle right here. We can see milk thistle. It's a seed. Everything else in there was and a coriander was a seed, but that's milk thistle, organic milk thistle seed. Now, we buy these milk thistle seeds whole, but before we put them in the tea, we give them a little grind. Let me just inspect here to see that this was properly done. Yep. And you can see the turmeric in there too, the yellow. And I can see the seeds have been broken up. The coriander has also been broken up. So that has been done properly. So that's good to know. It's all being done properly by my associates. Thank you, associates. Yep, thank you. Great job. We did a little inspection here live. It's good we passed. And also the coriander, that we get it whole. We don't want to use powder, so we put it in a stone grinder. So it just crushes it a little bit and breaks it up. And I think they do the same to the seeds, or they put it in a little quick blend in a little mixer, a little blender to break it up. And of course, because it's mostly roots and seeds, and no leaves, you have to do decoction. So we always explain to the client, you need to put in a heaping tablespoon, bring it to a boil, simmer it on a low heat for 15-20 minutes, and then strain and drink, and only have it in the day. Why do we say in the day? Because a lot of people, they drank it at night, and they had like a little burst of energy and they couldn't sleep. I can drink it at night. I haven't noticed that effect, but maybe because my liver's working fine anyway. But other people did tell me that when they had it in the night, then they couldn't sleep. So those are the most common ones. Oh, yellow dock. We have some yellow dock here too. It's in another formula we have. We have another one here called blood detox, and it's very similar. We use it more for skin problems, and it's balancing the pitta, cleanses the blood in the liver. But we put sarsaparilla root in it, along with the dandelion, the burdock, and there's a little Oregon grape, and licorice again as a catalyst. And sarsaparilla root's very good for the skin. It has that root beery flavor, and it's very nice tasting. Both teas taste very good because the dandelion is quite pleasant. And these teas should always be cooling. You shouldn't put hot herbs in here like ginger or black pepper. This is not healthy for the liver, particularly the pitta type of imbalance. So that's a general. And this one, the blood detox is more for skin problems and more for pitta. It doesn't even have the turmeric in it, which is related to ginger and can be somewhat heating. So it's more cooling. Another good home remedy for almost all liver conditions is aloe vera. Whole leaf has a minor laxative effect, and the inner leaf has no laxative effect. So depending on the individual, you may want to pick the right one. If you have loose stools, you don't want to pick the whole leaf because it could aggravate the condition. But aloe is very good. In fact, many of the Ayurvedic herbs have aloe in them in powder, and sometimes we have the client mix aloe with even that tea. They could have the liver tea a couple times in the day and put a little aloe in it. So aloe is very good. Now, if we let's look at the three types of imbalances that we have with the liver. And of course, we have three different formulas. Let's start off with the Kapha imbalance, probably the most common: fatty liver, cholesterol, sluggish bile, maybe even some gallbladder congestion, person's overweight, they're swelling, and have other, stagnating symptoms like this of even varicose veins with clots. So we have a couple formulas for Kapha, and then we can see right there, it says Ayurvedic liver tonic for Kapha. There we go. Let's get that baby to, there we go. See, decongests the liver, cleanses blood, improves metabolism. And there's the herbs. We're going to cover some of these. Kukti, probably one of the premier herbs in treating the liver. Very bitter. Most of these herbs are bitter that treat the liver. You're like taking your bitters. And these are all taken before meals, half teaspoon and a quarter cup of water before meals in caps. And bumiamalaki, premier Ayurvedic herb in liver treatments. Punaravas for the swelling. Kalmeg, another super bitter, the king of bitters. Manjista, which is also a cooling liver herb that helps with the skin. Bringraj, another premier one. And then ginger, because the Kapha person isn't hot. He's congested, fatty liver. So we need the ginger and the heat to help to thin out and liquefy the blood. And of course, that type of person, when you have a Kapha imbalance in your liver, fatty liver, high cholesterol, you need to be vegetarian and pretty much stop all meat, except possibly some freshwater fish like trout or freshwater salmon, or you could have some white chicken meat, maybe some egg whites, but that would be about it. You pretty much, if you have a Kapha liver problem and high cholesterol and fatty liver, you might as well just go vegetarian immediately. So generally put a person on the Kapha liver before meals, and maybe if they're overweight, then after the meal, we give them the Kapha weight loss formula. The combination is, and put them on a vegetarian diet. A couple weeks, you'll see big results. A few months, cholesterol drops. Now, if cholesterol is extremely high, then we want to have a gugulus in here. And I can show you a bag of gugulu in a minute, because that is very good for breaking down fat lipids. But you see, the rest of the herbs are very similar. Gugulu, Arjuna's for circulation, bumiamalaki, which I mentioned, and kukti, the bitter herb. And there's moringa we use, and it's very hot and good for Kapha. You don't want to take moringa if you're pitta or you have burning sensations or anything like that in the body because it's too hot. And then trikatu, which is made of 2 peppers and ginger. So this is a very hot formula. And the gugulu is the main ingredient. There's pure gugulu right there, which is a type of resin. And this dissolves and liquefies the fat right in the blood, the gugulu. And then the other herbs treat the liver. And this is very effective for lowering cholesterol. very quickly. So that's and then of course we'd give them the liver herbs, maybe the weight loss herbs, maybe and then the liver tea, and put them on a vegetarian diet. A couple months, blood work will be looking good, and we can take them right off the liver herbs, or at least first take them off the cholesterol herbs, maybe keep them on the liver herbs a little longer, then off the liver herbs, and just stick with the weight loss herbs. Because many of the weight loss formulas themselves have liver herbs in them, because what's helping weight loss, of course, is improving the metabolism of the liver. So if we don't have a serious liver issue, the person's fine eating fast food, fine eating oily foods, they have plenty of energy, but they're overweight, then we just give them the weight loss herbs, which was still going to help improve the liver function, because we need to increase the metabolism and the digestion of fat to help the person to lose weight. So let's go to the next category of liver imbalance, which is a Pitta imbalance. This is, we could say, an inflamed liver, a tender, sensitive, painful liver. And this type of person generally will have skin problems, rashes, hives, burning hands and feet, bloodshot eyes, be hot-tempered, and they could be getting hot flashes and not even be in menopause. It's a sure sign. If you're getting angry, having hot flashes, eyes are red, and you're having burning feet, and you press the liver and it's tender, and you feel like vomiting or throwing up when you have fried foods, we know the problem. This is a Pitta, we call heat, inflammation in the liver, completely different than what we just talked about earlier, the fatty or Kapha liver. So these herbs cannot be hot, cannot be spicy. There's no ginger, there's no pepper, and all cooling herbs. So as a Kapha one was bitter and hot, bitter herbs and hot herbs. Here in a liver formula, we have bitter and cooling herbs. You can see some of them will be the same. Bumiamalaki, the premier herb, shankpuspi for liver function and balancing Pitta because it's bitter. Shankpuspi, bitter. There's kukti again because it's really expensive but good for your liver. Manjista, good for the skin because this is going to help improve the skin condition. Kasni, which is a little more restorative. Kasni isn't used as much in Ayurveda, but it's not so much detoxing the liver, but supporting and restoring the liver and supporting it. And then Bring Raj, Kalmeg, they were in the other function. Little turmeric, and then the coriander. Coriander is the cooling aspect. So this is a sweet and bitter type of taste and it's taken before the meal, sweet and bitter, because we can't have hot because the liver is already inflamed. And this person has to be very careful with spicy foods, hot foods, chili peppers, and other things that will aggravate Pitta. And in that case, we would give them the blood detox formula because they probably have pimples, rashes, hives, or some skin condition. And if they had other conditions like acidity or heartburn as well, then we'd give them another formula after the meals for the acidity and the heartburn, and give them the Pitta herbs before the meal and the blood detox tea between the meal. And of course, at night, we give you a little extra herb too to help the liver, a little bumiamalaki at night. It's also nice. So now we talk about the third category, the dry, hard liver. You press on it, it's hard. I mean, in its later stages, it's basically cirrhosis of the liver, or there's at least dying cells in the liver. And all three types of function of the liver is impaired. It's just these are Vata, Pitta, or Kapha can impair your liver function. We're just classifying it because in Ayurveda, we have to treat the cause. And the cause is always Vata, Pitta, or Kapha. And, now we're talking about the Vata imbalance in the liver. So it becomes dry and hard and blocked, and there's gallstones and depleted and even dying. So we have a completely different types of herbs. We can see here, this is for Vata, improves liver function, cleanses liver. Again, half teaspoon before meals. But we say add a little ghee to it because this type of person has a very dry liver, and we want to add even a little butter. This person actually needs more fat in the diet. Where the Kapha person has the fatty liver and the cholesterol, this person needs more fat. They often have dry skin, cracking joints, dry, hard stools, so they need fat, more fat in the diet. So we use Kasni first because this is for the liver, and it's not that bitter, and it's more supportive of the liver than it is cleansing. Bumiamalaki, bringrod, shankpuspi, haritaki, which is basically a warm laxative, because this type of person needs, haritaki is balancing Vata and helping the bowels move. Turmeric, mangista, and kukti. So a lot of the same herbs, but different percentages, because when you know these herbs very well, you can adjust the percentages even for the different people with the same condition. You can adjust it. Now, if they're very dry, we also want to, and instead of adding a little ghee to the formula, we have liver ghees, you know, mahatikta, grita means ghee, and tikta means bitter. And there we got neem, guduchi, trukatu, mangista, bumiamalaki, we've seen everywhere, turmeric, and some bitter melon. And this one's even more gentle. I mean, it's because it's in ghee. It's more gentle than the dry herbs. And when a person is very dry or very sensitive, then we use the ghee. Even for children, we only use the ghee because they're so sensitive. So if the person's very thin, very depleted, hypersensitive, then we prefer to use the ghee than the powder. And if you're pitta, we would, of course, had you add aloe vera to it. We also have other types of liver formulas. This is called, we call it a liver elixir, but in Ayurveda, it's called Kumari Asav, which is basically fermented aloe vera with other herbs. So it's used for fatty liver and constipation. It's used for improving appetite and poor digestion and other conditions. And you can see the first two ingredients, aloe vera and aloe vera and haritaki. And it's fermented. So you can add just a couple teaspoons. This is best for the person with very low appetite, no hunger, having a lot of digestive problems, because it's already in liquid form and slightly fermented. Little heating. You can't use this for pitta. And best for fatty liver, because it's got this little alcohol content in it. So it's very good for kapha and maybe vata types. Because it's warming, so it's good for vata. It's got a little alcohol in it, which is very good for to help you absorb the herbs very quickly, just a couple percent, because it's fermented, more like a vinegar, and that will help improve digestion as well. So sometimes digestion is a very poor. We do have one formula here called liver and digest, taken before meals. A lot of times we use this for weight loss because it's more focused on metabolism. And again, there's got the guggulu, which we use for the high cholesterol, and the kukti, chickrots for digestion. Shilaji is a mineral sap, and there's triphala, amlaki, bibataki, haritaki. So there's a little bit more detoxing, a little bit more post-digestive effect, helping with digestion, but also liver. So it's we combine it a lot of times with the weight loss herbs, even when there's no big signs of liver problems, but digestion's weak and we need to increase the metabolism. Now this is an Ayurvedic, traditional Ayurvedic formula called Arganovati, and they're in little capsules, little balls, not tablets, we call them. And this is given out to, it's good for gallbladder, cleanses the GI tract, good for all skin conditions. And it has a trace amount of iron in it. And of course, we know the liver requires iron to function better and to increase metabolism. So it has a little bit of naturally processed iron, absorbable iron in it. So those are usually a supplemental. We usually give the main liver herbs and then plus these tablets. This is more supplemental. Even the elixir is more supplemental. And aloe vera is more supportive. So that's quite a bit of herbs there we got. And then, of course, the diet has to be followed carefully. And then you can improve your liver function over time. And of course, if you see other signs like yellowing of the skin, yellowing of the nails, this is like like jaundice, they call it, this yellowing of the skin. Then this is one of the signs. Often you can see it in the face, yellow tint in the face, and you can also see yellow in the nails. We didn't cover other hepatitis, and there's hepatitis A, B, C, and there's formulas for hepatitis, but I think it's outside the scope. But these of this talk really, but it's a pitta condition. It's in the pitta category. An infection in the liver, a virus in the liver is going to create this inflamed, sensitive liver, and then we have to treat pitta, some of the herbs that we talked here. But if we know there is a pathogen in the system, like in the case of hepatitis, then we'd have other additional herbs being used there. But many of the herbs that I just talked about would be still used. It's just additional herbs to help fight the infection, like neem, for example, and more cooling herbs. And if a person's very hot, they're getting a fever and they have a liver, and then we'd have a lot more cooling herbs. So you got that heat, that burning, the fever, and infection. This is all pitta in the liver. We call it pitta in the liver. So, this is the Ayurvedic perspective. They don't look at things from a modern medical viewpoint like the doctor would, because they're looking at it from the ancient understanding of the human body, which was more used to treat than it was to understand every little aspect of our health at a cellular level. They didn't understand things at a cellular level. So in fact, they couldn't even see bacteria, but they knew this inflammation, this heat, and this fever, there was some pathogen that was in the system inflaming the liver, and they learned how to treat it, even though they weren't able to know that it was a virus, for example. So, and I know people look at their blood work, and sometimes the blood work looks fine. The bilirubin is okay. The liver enzymes don't seem too high, but this doesn't mean that you don't have a poor functioning liver, and it's producing sluggish bile or clogging your gallbladder. So it just hasn't progressed to the point which is going to be picked up by the blood test. So don't think that you have a perfectly functioning liver just based on your blood work. You really have to look at the symptoms to understand the condition of your liver, the signs and the symptoms. So diagnosis is very important, and treatment only takes a few months, and then you can go back and check your blood work again. Same for fatty liver and cholesterol. Of course, it's easy to detect in the blood work, and it takes a few months of being a vegetarian, taking herbs, and your fat levels will reduce, your blood will thin, and your circulation will improve. Ultimately, you could probably change your diet and get results in a year or so, but the herbs will just expedite the process. It's like in the old days, they used to take the bitters before they had the meal. I know I've seen movies where the king was about ready to eat his duck, and he said, "Bring me my bitters," and they bring him a little bowl and a little spoon, and he takes just a small amount of these very bitter herbs, some of which we're still using today, and this would stimulate his liver and help him to digest and break down the fat. And many people who had difficulty digesting any fat at all, once they take the bitter herbs before the meal, for that meal, have no discomfort immediately. So you're really helping the liver to do its job. And of course, when you're cleaning the liver, you can't be constipated because you're trying to increase the bile flow. Maybe you're not producing this 100,000 milliliters of bile every day, and you're having all these digestion and absorption problems. So you start taking the liver tea, the liver herbs, it starts pumping out the bile. And of course, in the bile, we have a lot of heavy metals, dead bacteria, toxins, and other things as well. And if you're constipated, then, you're not removing this toxins quickly enough from the system. So you always have to keep the bowels moving while you're cleaning out the liver. There's other types of liver flushes and liver cleanses, but I find them more good for prevention. And, generally these slower, more safer approaches are herbal treatments. They're safer, proven, and it may take a little bit longer than some naturopathic liver flush, which I'm not saying doesn't work, but, when you have the herbs and you have a good patient who can take the herbs over time, then it's usually sufficient. And same for gallbladder. We have different herbs that will help dissolve the gallstones and make the gallstones smaller. And we'll do that, cover that in another webinar. So I hope this gave you a better understanding of the state of your own liver, gave you an idea whether you need to address and treat your liver. I mean, liver is, they say, as many as 500 different functions for our body. You know, and we didn't even mention things like producing hormones and other areas where poor liver function could affect you. And it's often underdiagnosed. It's undertreated, we should say, because they end up treating the allergies, the anemia, and these other conditions are, you know, pushing on the weight loss, starving themselves, working out, when the real problem goes back to poor liver function. And just because you don't have a high liver enzymes or high cholesterol, triglycerides on your blood work doesn't mean your liver's not functioning up to its best capacity. I mean, liver is a very filtering, cleansing, detoxing organ. It's if you're 60 years old, then, you know, it's 60 years old doing this work for you for 60 years. So you can see why, you know, it could need a little attention. I think almost all clients over 50 need some amount of attention to their liver, but just changing a person's diet, getting rid of the alcohol, the smoking, and the fast food. And, you know, this already will help the liver for most people. And one reason people feel better is that when they start eating better is that they've taken the burden off their liver, and now the liver's working better and their metabolism's better, and bowel movements are better, absorption of nutrients are better. So almost anybody can really benefit, except young children, from liver cleanses. And you find young children, for example, can be eating fried foods, oily foods, junk foods, pizza, greasy things. They're not complaining because their liver's dealing with it. The liver's still young. But when you're over 50, or let's say your liver's over 50, it's been 50 years, it's been around. You know, all the pollution and the toxins and the heavy metals and the mercury in your mouth, it's all your fast food, your alcohol, it's all burdened it to some degree. So everybody over 50 could use some level of liver treatment. And the herbs are safe, simple, and working quite nice. Results are quite good. So I hope that motivated you to understand your liver better and how important it is, and to consider treating it. Thank you very much, ladies and gentlemen.